Hello everybody, this is Dr. Joe, your endometriosis specialist. Today I'll be talking to you about what do you expect when you come in for your endometriosis consultation. We try to make our clinic a one-stop clinic. So what does that therefore mean? So when you come in, the first thing that we'll do, we'll have a lengthy conversation where we'll listen to your issues, your symptoms, and we're going to find out how long you've had these symptoms and how are they affecting your quality of life. For me, what I've come to learn is by listening to the patient, what patient tells you thinking is a sideline, not a very important information, ends up becoming the most important information that you might need, and that completely changes the story. So we'll have questions back and forth, and the usually open-ended question where you tell your story. This is going to include your previous medical history, if you've had surgery before, if you've had medical treatment that you've had before. And what we are currently finding is that most patients now who are reaching to us for endometriosis, they have been to different physicians. And either the symptoms have not been addressed appropriately, or it has been difficult to make sense out of the patient's symptoms. And that's the reason why we find that diagnosis for endometriosis can be delayed up to 10 years, which is something that shouldn't. So that first phase where we talk to the patient and review their medical history and so on, will end up coming and determining if patient has symptoms suggestive of endometriosis. And that's usually the very first phase and the very most important and crucial part. So of course, we'll ask patients if they've had previous medical treatment, if they've had surgical or imaging that have been done previously. It's going to be very important to bring that information with you during a consultation. Now, immediately we finish that, then we will determine, which in most cases will have a transvaginal ultrasound scan, which now has become the most important tool in determining how much of disease, if at all, is endometriosis that the patient has. But also, we're also finding in the event that we don't pick up endometriosis on transvaginal ultrasound scan, it does not rule out endometriosis. We still always want to depend on what patient tell us. So your symptoms should not be ignored because an image has shown different from what the physician was expecting to find. And that's what really makes a difference between endometriosis specialist and your regular, GP or physician. Then after ultrasound scan, which again is performed in our clinic, we'll come back, see it again, and discuss the findings. Now, the findings will help us decide on the option of treatment. So it can either be medical treatment, it can be surgical treatment, but then we'll give the patient time to go and think about the options. But what we found for patients who've had these symptoms for a long duration of time, we tend to depend more on less of medical treatment, and surgical treatment might be the option of choice. But then this is left between you and your endometriosis specialist to discuss and decide. So basically, once you come in on that single visit, you're most likely going to leave with a possible diagnosis and option of treatment. And I think that's how endometriosis care should be provided. If you're not getting this kind of care, I think it's important for you to keep looking until you find someone who understands and cares for endometriosis. Otherwise, when we find patients being sent for imaging at an imaging center, in most cases, the disease could be missed out.